our next speaker, our Averil Power. I keep going to say Averil. And I just want to say I'm really proud to have you here today. You have made an enormous difference to us in Cancer Trials Ireland in terms of what we're able to do. The contribution you make is made in a very trusting way. You know what we're trying to do. It enables a lot of what Angela and Deirdre said. It enables a lot of those not-for-profit academic trials that matter to patients. They would not be happening without you and without the Irish Cancer Society. As someone who's just been a patient, I've leaned on you, I've leaned on your team, and I have to say it's an incredible resource that is out there, not for everything, when you're a patient. And when you're up against it and you're really annoyed with certain things that are happening in the system, and then you see Averil in the Joint Oireachtas Committee standing up for you, there's nothing like it. So you're very welcome today, and we're very proud of you. Thank you.
Thanks very much. Thank you for an amazingly warm introduction, Evelyn. I'm really proud of you and really happy to see you back at the helm in CTI. Every 3 minutes, someone in Ireland hears the words, "You've got cancer." And in the blink of an eye, their world is turned upside down. Time stands still as they try to process what that means for them, what it means for their family. And all their future plans are cast into doubt, replaced only with questions like, why me? What are my chances of surviving? Will I still be here to see my children grow up, as Deirdre mentioned, or to celebrate my 50th wedding anniversary next year? Thanks to research, for most people, cancer is no longer the death sentence that it once was. Over 6 in 10 Irish people are now alive 5 years after a cancer diagnosis, and over 9 in 10 survive breast, prostate and testicular cancer. Today, a simple vaccine can prevent people from ever getting cervical cancer and other HPV-related cancers. More cancers are curable than ever before, and people are living for a long time with incurable disease, all things that seemed unimaginable just 10, 20 years ago. Cancer research has improved the way that we deliver chemotherapy and also helped us predict which patients don't need it. It has made radiotherapy far more targeted, and it has proven that our own immune systems can be trained to seek out and to kill cancer cells. And all of this has only been possible thanks to the people in this room and your colleagues in the global cancer community. As CEO of the Irish Cancer Society, there are 3 words that I hear a lot. The first is fear, because despite all the progress that we've made, being diagnosed with cancer is still a frightening experience, particularly for those with cancers with a poor prognosis. But the second is gratitude. Gratitude for the incredible staff working in Ireland's cancer services who do their very best for their patients, often in really, really challenging circumstances. Gratitude for the treatments that are giving people more birthdays, Christmases, graduations, and other precious moments together. And gratitude for the scientists who have worked painstakingly over many years to develop and refine those treatments. The third word that I hear a lot is hope. Hope that someone facing a terminal diagnosis today will live to see the breakthrough that makes their disease treatable and survivable. Hope for treatments that don't leave people with lasting effects such as infertility, incontinence and fatigue. And hope that improvements in prevention will spare others ever having to face cancer at all. An investment in cancer research is the only way that we can turn that hope into reality. And that is why the Irish Cancer Society has been proud to fund CTI since your establishment in 1996 and to double our funding for the organisation in recent years. It's why we're the largest voluntary funder of cancer research in Ireland. And it's why we're investing both in today's cancer leaders through buyout time for research and helping to create the leaders of tomorrow through funding for summer scholarships and PhDs. It's the reason we provided seed funding for bowel screening, €7.5 million for Breast Predict, and foundational investment in the really exciting All-Ireland Cancer Research Institute. We are proud of what our research investments have achieved and optimistic about the possibilities opened up by new advances in areas such as precision oncology, AI, machine learning, and digital health. But we're also extremely frustrated. We're frustrated that the National Cancer Strategy has only been properly funded in 2 of the 7 budgets since it was published. That the very modest target of 6% participation in cancer trials set out in that strategy is not being met due to many of the obstacles that have already been mentioned, and that the number of clinical trials in Ireland is only half of that in similarly sized Denmark. We're frustrated that bowel screen has not been expanded as planned in recent years, that Ireland is a laggard on e-health, that much of our infrastructure is creaking. We have machines, we've radiotherapy machines that are way past their use-by date and breaking down constantly as a result. Because underinvestment, missed targets and delays affect real people. They affect the quality of care that our clinicians can provide, and they limit the progress that our researchers can make. Recently, as Evelyn mentioned, Professor John Kennedy and I presented these frustrations and some more to the Oireachtas Committee on Health. We highlighted the political priority given to and the investment in Ireland's first 2 national cancer strategies, those published in 1996 and 2006. We celebrated the improvements that were made in Ireland's cancer outcomes as a result. But we also highlighted to members that in 2019, which is the latest year for which comparable data is available, Ireland had the 3rd highest cancer mortality in Western Europe. And our mortality rate was just barely below the average for the EU 27 as a whole, which of course includes countries far poorer than ours. More concerning, Professor Kennedy and I gave the committee a stark warning that with the impact of COVID-19 on cancer services and lack of government investment in the National Cancer Strategy, we are not confident that Ireland's relative position has improved since then. And that is not to say that nothing has improved in cancer in Ireland in the last 5 years, of course not. Thanks to research, our understanding of cancer has improved significantly in that time and is improving all the time. New diagnostic techniques have been introduced in recent years, and new treatments such as CAR-T have finally come to these shores, as well as new immunotherapies. However, the pace of progress in Ireland, I know that's a theme today, the pace of progress here compared to other countries is just so much slower. While others have raced ahead on e-health, Ireland remains a laggard. It is far harder to set up cancer trials here, as you've mentioned, than it is elsewhere, and Irish patients aren't getting access to new medicines as fast as their counterparts in other countries. In fact, access to medicines is an area of growing inequality since this National Cancer Strategy was published, because patients with health insurance can now get access to many new therapies that others cannot. I have to say that I thought long and hard about delivering such a stark message to the Oireachtas Committee, because I knew that it would be picked up by the media, and I knew how hard it would be for someone going through cancer to hear me say that, to hear the CEO of our National Cancer Charity say that, and to hear us, myself and John, point out that your chances of surviving the disease would be better if you were in a leading country like Spain, Finland or Sweden. But I also knew that if we didn't call it as it is, nothing would change, and we'd end up with yet another budget next autumn with no new recurrent funding for the National Cancer Strategy. And it wasn't a criticism of the Minister for Health, who I'm sure has pushed for as much funding as possible for cancer and indeed for the health service as a whole. But we know that that didn't happen in the last budget, not just for cancer, but also we have a massively underfunded service, which in itself is putting more pressure on cancer because other parts of the system, ED and other areas, aren't working. And it certainly wasn't a criticism of the NCCP, who I know made the case within the HSE for more funding for the National Cancer Strategy, and who have delivered significant improvements in the years in which they have received extra funding, particularly in areas such as psycho-oncology, nursing, and the new acute oncology nursing service. But rather it was a call to the government as a whole to do better, because cancer patients and those who love them deserve better. They deserve for Irish people to have the best possible chance, not just an average chance, not a mid-table chance, but the best possible chance of surviving cancer and of living a good quality of life afterwards. I'm deeply grateful to all the clinicians and researchers, and I know some of you are here, who later co-signed a letter to Simon Harris as Taoiseach, calling on him to secure proper funding as Taoiseach for the National Cancer Strategy, which of course he launched as Minister for Health in 2017. And I know that many others would have added your names if you'd had time. We had to pull it together ahead of we were in the Oireachtas Committee, I think, on a Wednesday, and then we were off the back of that, we got a special 2-hour debate on the National Cancer Strategy in the Dáil the following Tuesday, so literally spent the weekend calling some people here, Liam, and I see Seamus and others here, calling people and asking them to sign the letter and ask colleagues to do the same. So we didn't have much time, so apologies, didn't get a chance to get around to everyone, but we did secure at least one person from each of the cancer centres across the country, and people representing all the different disciplines as well within the profession. And I want to thank everyone who did sign that letter, because it did make a difference. And with an election coming in the next 10 months, I think it's really important that we continue to support each other and that we continue to use our collective voice on behalf of those who are relying on us to ensure that we can deliver greater investment and practical support both in the next budget later this autumn, but also for the next 5 years. And we're briefing politicians now, spokespersons, who are putting together their manifestos and their plans for the next 5 years. So this is a really, really critical time. As you know as well, that some people know, the Irish Cancer Society has funded Mazars to undertake an independent scoping review of the cancer clinical trial landscape in Ireland, including the barriers and obstacles to trial access. And I'm thankful to those of you again here today who have fed into that. And by undertaking this piece of work, we hope to have a series of practical recommendations in the coming months on how we in the community can plan and improve the cancer clinical trial ecosystem. And these recommendations, together with all the amazing work that Evelyn, Angela, Deirdre and the team have done within CTI, will help to inform our collective advocacy about what we need to do to get to that 10%. So I want to conclude by thanking all the team at CTI for organising this excellent event and for the opportunity to speak to you this morning, by thanking each and every one of you for all the work that you're doing to improve how we prevent, detect and treat cancer. The Irish Cancer Society is really grateful for everything that you're doing to transform what is possible today and to inspire hope in what could be possible tomorrow. We really appreciate your dedication and your persistence in, as has been said, often a very challenging environment, and have huge respect for you for all the work that you're doing. And we're determined to do everything that we can to help you through our funding, through our advocacy and through our public communications, because the title of this session says, "Together we are stronger." Together we can find new and better answers to cancer. Together we can turn potential into real world progress. And together we can turn today's terminal cancers into tomorrow's treatable and survivable ones. Thank you.
That's a lovely note to end this session on, and we are better together, that's for sure, Averil, and thank you so much. I think I certainly, for me anyway, and for everyone in this room, we feel like the Irish Cancer Society has our back in the research world and is advocating for us, but is also advocating for our patients, and I can wear both hats now, so some people aren't going to like that, I can tell you that much, down the road, and very willing to. But, you know, one of the things that's, when you're a patient, is really important is all the other things. It's not just meeting the clinician and getting the diagnosis and getting the drug, it's the physiotherapy, the nutrition, the advice, the advocacy. Siobhan Gaynor's looking up at me. Siobhan Gaynor arrived at my door a week after surgery with a big basket of fruit. and it's when you meet other people who have a similar condition to you, and you meet other people who understand, it's really important. And I know the Cancer Society and other cancer organisations, patient organisations facilitate that, and that's hugely important as well. So thank you. We have another session now, which